Olive, I believe that the government is so bright, and the government has managed to rein in the unions by diverting their attention. Right now, the mandate of the union is to negotiate CBAs and also dispute resolution, and also to make sure that the unions follow up on implementation of promotions, welfare of the health personnel, and the rest. But look at what the government has managed the unions to do. The government has managed to put the unions in a situation where they are looking for, the unions are now looking for salaries for their members. So this one, to me, is a diversionary tactic by the government, which the unions should be smarter to overcome. I also don't believe that the issue is about empty coffers, because most counties have paid their workers. So why is it that only a few are left that, that have not paid their workers? I want to take you through the life of a healthcare provider, basically a nurse. A nurse goes to, nurses make 65% of the health workforce in Kenya. And a nurse performs almost 80% of health services in all our healthcare settings. So a nurse in any clinical setting, for example, let's take for example, maternal child health unit. A nurse goes, have several activities running in that department, like immunization and family planning issues. But in the case of maybe a nurse gets 40 mothers, clients coming for antenatal clinic, there is a whole antenatal profile that a nurse has to go to. You take the vital signs, take this mother through history taking, do investigations that include testing for malaria, testing for levels of blood levels of HB, urinary disease, rhesus factor, PMTCT, venereal diseases, and all those other things, just to make sure that the nurse has a complete picture of the patient. Then from there, the nurse goes and do examination of the patient to confirm everything is possible, to the extent that at times we even do obstetric ultrasounds to these clients. By the time you finish with the one client, it will take you like 20 minutes. And you have a whole lot of 40 patients waiting for the same nurse. Most nurses work 2 or 1 in level 2 or level 3s. So if this small component this small department has taken like 20 minutes per patient, 40 patients are waiting for you, 50 patients to wait for you, it will take you like 16 hours to complete this. And remember, you have other activities to do. This nurse goes home without anything. The salaries are delayed for 3 months. Does not have transport. The children are waiting for him or for her, as Dr. Michaela has already said. And then you have got also bills to pay. Right now, most health workers have been evicted from their houses because of delay in payment of salaries. But they are also taxpayers. They are deducted from their slips. So the issue of empty coffers does not come in. What the government needs to do is prioritize on its mandate, on its objectives, so that health becomes a priority. Salaries of health workers should be a priority to every county government that is the employer of nurses. But then the county are also not employing, because they know that they don't want to invest in health, and that's why we know we know the problem. And these are historical injustices that has been happening in health for a long time. We have the answers to this, but politicization of health has not made it easy for healthcare to be taken seriously in Kenya. Thank you.
Politicization of health.